for joining us for today's presentation. We have representatives from both our Ministry of Heritage, Sport, Tourism and Culture Industries here with us today, as well as representatives from the Ministry of Health and the Chief Medical Officer of Health's office. Before we begin, I just want to remind everyone that we will be taking questions in the time that we have available for us today through the QA function below. We'll try to get to as many of your questions as possible, recognizing that some are very similar and some are very nuanced, but we'll try to address as many of the high-level overarching questions to give you as much guidance as we possibly can, as well as we will share the deck after today's presentation with you electronically. But to kick us off, I'll turn it over to the Honourable Lisa MacLeod, Ontario's Minister of Heritage, Sport, Tourism and Culture Industries, to get us going.
All right, thanks Derek. Thanks everyone for joining us today. I know we're very well attended and we continue to grow. Keep the questions coming in. You can always use the Q&A function in the chat box to ask some questions if you have any. And we are obviously today going to be talking about the first set of restrictions that are going to be lifted as a result of the early January measures that were put in place as a result of the Omicron virus. We do have a great deal of supporters on here that will be able to answer your questions. So I want to thank my team over at the Ministry of Heritage, Sport, Tourism and Culture Industries. So my Deputy Minister, Sarah Harrison, is joining us, as our Deputy ADMs, Tyler Curry, who you know quite well, and of course, Catherine Kelly Gatton, who has just joined the ministry this month. And what a time to join. But anyway, we are also joined with Dr. Murdy, who is the Deputy Chief Medical Officer of Health, as well as someone who has been working with us from the Ministry of Health for the past number of years, Colleen Keel, who will walk us through the deck, as well as Chris Harold, who has joined us on many occasions. So obviously on January 31st, places across Ontario will start to reopen in a variety of the heritage, sport, tourism and culture industries. We do still have some capacity limits in place and some restrictions that will continue to be lifted both in February and the beginning of March. But today's regulations that we're going to be talking about were ratified by Cabinet on Wednesday, communicated yesterday by the Chief Medical Officer of Health, and have given you time the last 24 hours to digest how these may impact you and your organizations. But I think I'd like to say thank you to all of the stakeholders in the past week who've reached out to the ministry for clarification, which has helped guide our requests and questions to the Ministry of Health and the CMOH. And I would like to just point out that as a result of that, we were able to work in real time on dealing with food and beverage for many venues, including cinemas. And so that, of course, has now been approved. And then also with the QR codes that are happening for international visitors, so that they may be able to take advantage of our restaurants and of our other entertainment opportunities. So without further ado, again, I encourage you to use the Q&A function. If you have any technical questions, we'll get to as many as we can. If we don't get to them today, as always, please email minister.macleod@ontario.ca. We're here to support you, and the entire team from the Ministry of Health and the Ministry of Heritage, Sport, Tourism and Culture Industries are here to try and get you timely answers in the best of their best ability today. So without further ado, I'll turn it over now to Colleen so she can walk you through the deck. And then any questions at the end, Derek will be able to help moderate and send them to the right people. So Colleen, it's over to you. Thank you.
Thanks, Minister. And thanks to everyone for joining today. I do want to just point out the amendments to the regulation, which Minister MacLeod referenced as being approved and announced this week. The consolidated version of those amendments is now available at the link for OREG 364. So that was, sometimes it's only the amending regulation, which is harder to understand, but in addition to the deck that you'll be provided, the actual regulation is now completely up to date. So I'm just going to jump ahead to slide 4, actually. Thank you. So just a quick reminder, and I know many of you were on the stakeholder call last week, so not to repeat, but too much, but and we'll get into the details of the measures shortly. But just a reminder around the metrics that were guiding the recommendation to move out of modified step 2 and to begin back into the step 3 regulation. So an overall risk assessment was done by Dr. Moore, the CMOH, along with many colleagues in the ministry and our partners to apply public health and clinical judgment based on some key indicators, which include declining percent positivity, declining numbers of outbreaks in higher risk settings, and plateauing or decreasing hospital and ICU admissions. So as we start to see those, a cautious and gradual approach to reopening is the way that we are stepping forward and beginning on Monday back into the step 3 measures. Next slide, please. This slide is just really a foundational slide of like the fundamental measures that continue to support our reopening and will continue to support us through the many months ahead in terms of the kinds of things that citizens and businesses need to be aware of. Staying home when sick, vaccination against COVID, with emphasis on the 3rd and 4th doses where applicable. Requiring proof of vaccination in select settings, which is continuing at this time, wearing a well-fitted mask or face covering, distancing, hand hygiene, respiratory etiquette, cleaning and disinfecting surfaces, and attention to ventilation. I know you've all heard that before, but we continue to promote those as the foundational measures. So I'm going to start the next slide, please, with the summary of measures that apply to individuals. And these continue as we move into step 3. So face coverings or masks are required indoors in a business or an organization that is open. And when an individual is attending an indoor event and is within 2 meters of another person who's not a part of the same household. The face covering or mask must cover the mouth, nose, and chin, and limited exceptions to face coverings apply. Physical distancing also required indoors at businesses or facilities that are open, attending organized public events, not required in certain settings where proof of vaccination is required, or settings which are allowed to opt in to the proof of vaccination requirements and they choose to do so. There are additional exceptions, including for members of the same household or when necessary to be closer to complete a transaction or receive a service. Next slide, please. In terms of instructions from public health officers, businesses and organizations must continue to comply with advice and recommendations and instructions that are issued. So would encourage folks to be familiar with what might be issued locally by their local medical officer of health, as those still apply in case of any active measure instructions that are in place. Active screening of workers continues to be required. Passive screening of patrons is required. And active screening of patrons is required in certain settings, which we'll walk through as we go through the sectors. Face coverings and masks, I think I just went through that, but that seems a bit, yeah, I think it's the same thing. And requirements when workers eat or drink. So this is distancing or an impermeable barrier when workers are removing face coverings to eat or drink in their place of work. Okay, next slide, please. So proof of vaccination requirements against COVID-19 is required in select settings, and some settings can continue to opt in to those in addition to the settings that are required to be part of this program. We will walk through the slides that talk about where those requirements apply. Generally, capacity is limited to the number of members of the public that can maintain distancing of 2 meters, subject to any other capacity limits outlined in the regulation. So that means if there is not a specific capacity limit applied for settings that we're going to go through, a lot of which is 50%, the indoor capacity limit remains at distancing. That would be a lot of public settings. Lineups and congregations outdoors, so outside a business or a place that is open, must be managed to ensure they maintain distancing. Lineups indoors also must be managed to ensure distancing and face coverings or masks are worn. And then cleaning and disinfecting, the continued requirement around equipment, washrooms, locker rooms, cleaned and disinfected as necessary to maintain sanitary conditions. So I'll move into the setting-specific ones on the next slide, I think. Oh, a few more, sorry. These are the general ones. Sorry, just quickly go back to 9. I can just whip through those. So that's PPE and, oh, we went the wrong direction. One more. There we go. Thank you. Personal protective equipment for persons providing services, if required, in the course of providing services, to come within 2 meters of a person who's not wearing a face covering or mask indoors. So that includes PPE for the eyes, nose, and mouth for workers. Safety plans must be prepared and posted and made available upon request. For live entertainment, performers must have a 2-meter distance or barrier from their audience. And then for roof canopies and tents, if they're used in outdoor areas, must have 2 sides or 2 full sides or 1 full side and the roof open to the outdoors. Next slide, please. Okay, so starting with personal care services, which includes the list that is there, hopefully covers the broad range of this category. Open with capacity limited to 50%. Personal care can also elect into the proof of vaccination requirements, in which case physical distancing requirements would not apply. Appointments continue to be required, active screening, and personal protective equipment must be worn by people who are providing personal care services. Oxygen bars remain closed. And just a note to add that services that require the removal of a face covering and mask or mask are now permitted. Next slide, please. Social gatherings and organized public events are permitted with an increase to 10 people indoors and 25 people outdoors. Organized public events go up to 25 indoors with no limit outdoors. There are some exceptions for this that apply, amongst others, to gatherings in retirement homes and those held in a business subject to restrictions that are listed in Schedule 1 or 2 of the regulation. Wedding, funerals, religious services, rites, and ceremonies, not the social gathering part, are permitted with an indoor capacity of 50% of the particular room, and outdoor capacities limited to distancing. Social gatherings associated with those events are subject to the restrictions in social gatherings unless held at a meeting or event space or a food and drink establishment, in which case those provisions would apply. Bathhouses and sex clubs remain closed at this time. Okay, next slide, please. So meeting or event spaces, conference centers, convention centers are open with an indoor capacity of 50%, with a maximum capacity required to be posted. Proof of vaccination applies indoors and in outdoor areas that have a usual capacity greater than 20,000 or more. Limit of 10 people per table. Patrons are required to remain seated with limited exceptions, which include going to and from the washroom or accessing a buffet or for health and safety purposes. There's no patrons are permitted to dance or sing, including by performing karaoke. Screening is required, active screening for individuals, and rooms must be separated by a partition with a hard surface. There are some limited exceptions to some of the requirements above. Next slide, please. Libraries are open. Libraries have a capacity limited to the number of people that can maintain distancing, with exemptions for parts of the library that may be used for day camps or overnight camps, childcare, or social services. For concert venues, theaters, and cinemas, they're open with a capacity limited to 50%. For concert venues and theaters with capacity limited to 50, or where there's seating capacity, 50% of the usual seating capacity, or 500, whichever is less. Similarly, maximum capacity must be posted. Proof of vaccination applies in indoors and in outdoor areas greater than 20,000. Similar requirements to event spaces in the seating requirement and screening. Reservations are required. And then there's general compliance requirements for masks and face coverings applied in those settings as well. Next slide, please. For fairs, rural exhibitions, and festivals, similarly to other settings, open for indoors at a capacity of distancing, and in any event not greater than 50%. Any particular indoor attraction within any of those facilities must be limited also to 50% with distancing applied as well. And then again, similar requirements around capacity being posted. This is a sector that can elect into the proof of vaccination requirements, in which time the physical distancing requirements would not apply. There are restrictions for concerts, events, and performances or movies that may be held at any of these establishments, and those provisions would then apply as well. A safety plan is also required with the additional requirements for safety plans. Next slide, please. Amusement parks open with indoor capacity limited to those that can distance 2 meters and in any event cannot exceed 50%. Similar to the fairs and rural exhibitions, any indoor attraction is also limited to 50% with distancing and the ability to opt into the proof of vaccination requirements. Reservations are required. And then there are restrictions for the specific kinds of events that may be held at an amusement park, in a concert venue, a theater, or cinema. Safety plans continue to be required, and distancing is required on any indoor amusement rides. Next slide, please. And water parks. Water parks can be open with an indoor capacity similar to most other settings at 50%, as well with capacity limited to also by distancing. Any particular indoor attraction within the facility, similar to amusement parks, are also applicable for, or also subject to the 50%. And proof of vaccination requirements apply indoors and in outdoor areas with capacity of greater than 20,000 or more. For businesses that provide in-person teaching and instruction, this is indoor capacity limited to the number of members of the public that can maintain distancing, except where necessary for teaching and instruction that can't be provided if distancing is maintained. Maximum capacity must be posted, and any indoor instructional space must be operated to enable a distance of 2 meters and can't exceed 50% capacity or 1,000 persons. Touring guide services, any indoor portion is limited to 50%, and they may elect into the proof of vaccination requirements, during which time physical distancing would not apply. This sector includes guided hunting trips, tastings at wineries, breweries, or cideries, and fishing charters, and trail riding tours. Maybe not in January, but maybe there are some. Okay, next slide, please. Boat tours, again, open with capacity limited to the number that can maintain a distance and not exceed 50%. Posting of the maximum capacity, they may elect into the proof of vaccination requirements. Active screening of employees and performers is required. Reservations are required, and this is limited to tours that embark and disembark within Ontario and that are not otherwise prohibited to operate. For commercial film and TV production, studio audiences indoors are limited to 50%. Maximum capacity should be posted, and proof of vaccination requirements do apply indoors. Masks must be worn unless performing or rehearsing, or in a concert, event, or performance. There are additional restrictions that you're likely very familiar with that are the guidance outlined in the guidance document, Film and Television Industry Health and Safety, and safety plans are required for this sector as well. Okay, next slide. Museums, galleries, aquariums, zoos and science centers and landmarks, historic sites, botanical gardens, and similar attractions. For indoor capacity here, it's 50%. Any particular room is limited to the number of people that can distance 2 meters and cannot exceed 50% of the room. Indoor capacity for members of the public at a seated event is limited to 50%. As with many, if not most, maximum capacity must be posted on a sign. Proof of vaccination this is a sector that can elect into the proof of vaccination requirements, and during this time, physical distancing requirements would not apply. Reservations are required for indoor events or seated events, and then any of the restrictions for concerts, events, or performances that are in other sections would also apply here. Safety plans are required. And if there's any indoor rides or tour vehicles, masks and face coverings are required. Short-term rentals are open. Any of the indoor sport or recreational activities or facilities must comply with restrictions for sport and recreational fitness facilities. Okay. Restaurants, bars, food trucks, concession stands, and other food or drink establishments. Indoor capacity at 50%. Maximum capacity needs to be posted. Proof of vaccination requirements apply indoors, with exceptions that for takeout and delivery service. There's a limit of 10 people per table, and patrons are required to remain seated with limited exceptions, similar to what was outlined in meeting and event spaces. So going to the washroom, health and safety reasons, or accessing a buffet. No dancing or singing by patrons, and businesses must actively screen dine-in patrons. Exemptions to some requirements apply for restaurants that are located in a hospital, an airport, or if the only people in the establishment are those who work for the establishment. So safety plans are also required. Just a note here, previous restrictions on hours of operation or on the sale and service of liquor have been lifted. Next slide, please. Nightclubs, resto clubs, and other establishments, food or drink establishments with dance facilities. So open indoors if operated solely as a food or drink establishment without dancing, and comply with the conditions set out on the previous slide for restaurants and other food and drink establishments. So open outdoors subject to the restrictions that have been in place previously. So capacity limited to 75% or 5,000 people, maximum capacity being posted, proof of vaccination applying, indoor areas closed except for patrons to use the washroom, unless the indoor area is operating as a restaurant. The establishment must be configured so there's distancing between the tables. Every patron must wear a mask or face covering. Screening is required for patrons, and if there's any coverage by a roof or canopy, the outdoor area must have 2 full sides or 1 full side and a roof open to the outdoors. I'm going to go to the next slide, please. Strip clubs can be open with an indoor capacity to 50%. The total number of patrons permitted to be seated must be limited to permit distancing. Distancing is not required when patrons are seated together at the table. Capacity must be posted. Proof of vaccination applies. No singing or dancing by patrons. Performers must be distanced from patrons by 2 meters. And businesses must actively screen individuals, and there must be a safety plan. So the other note there is that there must be compliance with the requirements for restaurants, bars, and other food or drink establishments whenever food or drink is sold or served in any part of the business. Next slide, please. Sport and recreational fitness facilities. Open with an indoor capacity limited to 50%. Indoor capacity for spectators is 50% of the usual seating capacity or 500 people, whichever is less. Capacity must be posted. Proof of vaccination continues to apply indoors and in outdoor areas with a capacity of 20,000 or more. Every indoor spectator must remain seated while consuming food or drink, and every indoor and outdoor spectator must wear a mask or face covering that covers their mouth, nose, and chin. Active screening is in effect. League or event must have safety plans with additional requirements that are outlined in the safety plan provisions. There must be a facility safety plan as well. There are some exemptions that do apply to some of those requirements. Okay, going to go to the next slide. For personal physical fitness trainers, similarly, it's 50% in an indoor capacity, but also distancing of 2 meters between patrons. Trainers must actively screen individuals and have a safety plan. For community centers and multi-purpose facilities, they're open with capacity limited to the number of people that can maintain distancing, with exemptions for any part of the community center or multi-purpose facility used for day camps, childcare, social services. Any indoor or sport or recreational fitness activities that are taking place in those facilities must comply with the restrictions for sport and recreational fitness facilities. For camps, day camps and overnight camps are permitted to operate in accordance with the guidance from the OCMOH, and that guidance was recently updated in December, is available online. And next slide, please. Horse racing tracks, car racing tracks, and other similar venues, indoor capacity at 50%, posting capacity is required, proof of vaccination required indoors and outdoors with usual capacity of 20,000 or more. Patrons must be seated at all times if consuming food or drink. Active screening for patrons. Every member of the public must wear a mask or face covering, indoors or outdoors, and a safety plan is required. Indoor recreational amenities are open with a capacity limited to 50%. Maximum capacity must be posted. This sector can also elect into proof of vaccination requirements, during which time the distancing requirements would not apply, and the requirement to post a sign that those requirements are in place. And then the restrictions for sport and recreational fitness facilities can apply to these settings as well. For outdoor recreational amenities, indoor capacity for any clubhouses is limited to distancing and with not being able to exceed 50% of the clubhouse. Maximum capacity must be posted. Indoor clubhouses may also elect into the proof of vaccination requirements, during which time the distancing requirements would not apply. And any indoor rented space must comply with the meeting and event space provisions in the regulation. Retail. So for retail, continue to be open with an indoor capacity limited to 50%, and the capacity must be posted. If patrons are permitted to test drive any vehicles, they must be screened, actively screened and wearing face coverings or masks. Specialty vape stores cannot permit electronic cigarettes to be used for sampling. And cannabis retail stores may open and provide products through in-person sales, curbside pickup, or delivery. Shopping malls, for capacity, it's limited so that the number of members of the public in the indoor area does not exceed the total capacity determined by taking the sum of the capacities of every business in the mall that's operating at 50% capacity. Maximum capacity must be posted, and then no loitering provision continues to apply. For photography studios and services, they are open with an indoor capacity limited to 50%. Posting requirement for signage there. May also elect into proof of vaccination, during which time distancing requirements would not apply, and they must actively screen individuals indoors. Real estate open houses may be open with an indoor capacity limited to the number of members of the public that can maintain distancing. and they may also elect into the proof of vaccination requirements. Campgrounds can be open, and any facilities or fitness for sport or recreational fitness must comply with those restrictions. Hotels, motels, lodges, cabins, cottages, resorts, other shared or rental accommodation can be open with similar provision about any other facilities on those sites. Marinas and boating clubs open for 50% with requirements to post their capacity. And similarly, any sport or recreational activity facilities within those settings must comply with those provisions. Driving instruction is open. Every student must be actively screened, and every student and instructor in a vehicle must wear a mask or face covering at all time. And then for driving instruction, the in-class portion must comply with conditions for in-person teaching and instruction. Casinos, bingo halls, and gaming establishments can be open with an indoor capacity limited to 50%. Requirement to post that capacity. Proof of vaccination continues to apply indoors. Patrons must be seated at all times while consuming food or drink. Active screening of individuals must continue. No loitering or congregating around tables where games are played. Continued separation of employees from table games, so table game employees separated from patrons. Restrictions do apply for any events being held in those establishments as applicable to concert venues or theaters or cinemas, and the general cleaning requirements for chips or cards or dice and other table game equipment, and safety plans continue to be required. Before going into the next couple of slides, I did just want to note, as it may not have been explicit in the previous slides, the requirement to collect patron contact information has been removed from all businesses and organizations, and so that was announced as part of Dr. Moore's announcement yesterday as well. So you won't see it. It wasn't listed there because it's no longer a requirement if that is unclear. So updates to the proof of vaccination program. So December 20th, just a few things here. Expanded booster eligibility went into effect. So 18 and over became eligible for their booster doses. And at this time, the definition of what it means to be fully vaccinated still remains the same. So it is still at 2 doses. And so there has not been a change to that requirement, but certainly lots of encouragement for folks to get their 3rd doses for added protection. It is now mandatory to use the enhanced vaccine certificate with QR codes to gain access to settings that require proof of vaccination. The QR code can be used digitally or by printing a paper copy. Businesses are now required to verify their certificate using the Verify Ontario app, which is available to download for free. And individuals will continue to need to show a piece of identification matching their name and date of birth. As of January 10th, organizations and businesses should no longer accept physician notes or documentation as it relates to medical exemptions. The Verify Ontario app has been updated to read and assess their exemption. Will return the same green or yellow screen or red screen that you see when scanning regular certificates with QR codes. Medical exemptions issued outside Ontario are not eligible for this enhanced vaccine certificate, and those individuals should see an Ontario physician or registered nurse in the extended class or nurse practitioner to seek a medical exemption. So there's a couple of exclusions to the use of mandatory vaccine certificates. One is for our First Nation communities, and the other is for any international visitors to Ontario who don't have a scannable QR code. So the list of First Nations is included on this slide. And then for the visitors to Ontario from outside of Canada who don't have a QR code, they must show businesses their international vaccine receipts and a valid non-Canadian passport or Nexus card. for visual verification of their proof of vaccination. This is an interim measure until they can be assigned a temporary traveler's QR code by the federal government. And we do have some updated posters for businesses and organizations to print and display. I think my colleague Jody Malnichuk is on the line, so if there's questions on this part, hopefully she can answer those. And next slide, please. Got through to the end.
Thank you very much, Colleen. I know that was a lot of information there to digest, but we greatly appreciate you walking everyone through some of those particulars. I know some questions have come in here that are maybe very technical or have been answered throughout the presentation, so please bear with us if we're duplicating some answers here. Just quickly before we get into the QA function, I just want to ask quickly, Colleen, you had said at the top that it was Regulation 6420 that's been updated online, correct? And that's the one that we're referring to?
36420.
Sorry, 36420, that's correct. Yeah.
So it's all the step 3 reg. It's all in the rules for areas in step 3. Yeah, that's it.
Excellent. Perfect. Because I have shared that in the chat for everyone's benefit now. If you are looking for the legalese of everything, that is the place to look. But we'll get into some of the questions now. So first, this has to do more with the tourism and recreation space of things. The question is with regards to multi-auditorium cinemas as well as event spaces. Does the 50% capacity rule apply per room, or is it based on the venue overall? Now, maybe throw that. I know we've got a few guests on the line here as well. We've got our ADM for tourism, Catherine on the line, as well as ADM Tyler Curry for sport. For medical questions, we've also got Dr. Murty on the line and Chris Harold as well. So, Colleen, maybe I'll throw that one to you first, and then if Catherine, if you want to chime in, or anyone else, by all means.
Yeah, so in general, it is the facility overall in terms of the 50% capacity rule. It gets a bit challenging without understanding the exact facility setup, but broadly speaking, it's 50% for the entire facility.
Okay, thank you. I have a similar question and probably the same answer, but just to clarify, does that also apply to multi-purpose facilities in the sporting area? So think a multi-pad hockey arena, for example.
Yes.
Excellent, thank you. I have a question here looking for clarity on the expectations for active screening now that contact tracing is no longer required for recreation facilities. So just wondering if we could walk through what active screening requires exactly. Sure,
and I might need to phone some friends on the line with this, but generally active screening requires there to be some sort of an interactive component. So if people choose to do something that's using the online screening tool, they're showing it to someone on their way in, or they're being asked questions by somebody on their way in. And so the difference being, in layman's terms, really passive screening would be you just trust everyone coming in has done their thing, and they don't interact to tell you that in any sort of way.
Okay, thank you. Did anyone else, any of our panelists wanted to contribute anything further on that?
There's a link when the deck goes out. There is a link in the general compliance provision around screening, and those tools are constantly being updated and have been updated recently to align with these changes.
Perfect. Thank you very much. Our next question comes from the live music sector, asking about general admission at concerts. Is it still required to remain seated as of the 31st? This would be for spectators.
Yes, it is as of January 31st. And I know there's probably questions about the future dates, and we can't answer those questions exactly today, but for January 31st, yes.
Perfect. Thank you very much. Another question related here around the food and beverage, specifically within recreation centers, including sports facilities. Are canteens in recreation centers allowed to sell food to clients?
They are, as long as people sit down when they're eating.
Okay.
Yeah, the requirement is about seated while eating or consuming beverages. So sales as they take place from a concession stand impacted.
Perfect. Thank you very much. I know we've received this question a few times to our office as it relates to youth sport and dressing room and change room capacity. Just looking for clarity if it's 50% for the room and if 2 meters of physical distancing is required.
I'm going to just phone some friends on this one.
Yeah, Colleen, there's no, because proof of vaccination is in place, there's no requirement for individuals to maintain physical distancing. There's just sort of the 50% across the building.
Great. Thanks, Chris.
Thanks so much for that, Chris. Appreciate your help. Looking for, again, clarity on masks required for outdoor tours or small events. Is masking required in those settings?
Also phoning friends on this one just to make sure I get the right answer.
So Derek, could you repeat the question?
Is masking required at outdoor venues, in particular tour facility? Very much. I have a question here. It probably relates to something that was noted at the end of the presentation, is around vaccination exemption notes. So wondering if you can just provide clarity on vaccination exemptions, particularly if a family doctor provides a written note.
Yeah, it's Jody. Yeah, I can do that. We changed the process on December 15th. So issuers of medical exemptions include your family physician, includes registered practitioners, specialists. But the change in the process is that they would have to complete the documentation and then send it to their local public health unit. The public health unit will then review it and then start the process to upload the credential into the COVAX system. So a doctor could certainly issue it to the individual, but the individual would not be able to use that doctor's note for entry into these prescribed settings.
Perfect. Thank you very much for that clarification, Jody. Going to go back to the sports sector for a moment here. And actually, Jody, it may require your support as well, because it has to do with vaccinations for kids under 12. So the question is it still 50% capacity for sports facilities with kids under 12 that are exempt from vaccination, or do we have to use the 2 meters of physical distancing rule as a guideline for capacity?
I am happy to pass all capacity questions over to my good friends, Chris and Colleen.
Sorry, so the question is whether the capacity is different when it's children under 12?
Correct.
So the capacity requirements are 50% across the board, not in relation to who's in the building, where the under 12s are exempt from the proof of vaccination requirements.
Perfect. Thank you very much. Okay, let me see what else we have right here. So question here with regards to gyms and recreation facilities again. So when opening on the 31st, what are the responsibilities of the gym, dance studio, or other recreation facility if an adult or youth participant in their programs catches COVID? So I guess maybe the question is probably more for Dr. Murty, just looking for clarity for those settings that may have been identified as a source of transmission. What's the responsibilities of the business from reporting maybe to public health authorities?
Yeah, so I think that the changes here that we're making is that no longer being required to collect contact information of all patrons within these settings. There's a specific patron who would be a case and that the business owner becomes aware of that. There's not a specific requirement anymore for the business to connect with public health on that awareness. There is still requirements, though, under Occupational Health and Safety Act, that if it's an employee of that setting, that they would still have to be alerting their employer if they're concerned that they acquired infection at the place of work.
All right, thank you very much. I have another question here related to meeting and event spaces. Does the separation between tables of 10 or less require 2 meter physical distancing from the next table? Is that still required as part of the regulations? You'll throw that one.
No, that's not in the regulation anymore.
Perfect. Thank you very much. Okay. And going to go back to another question related to guidance on active screening. Just as a reminder here, and I think you addressed this, Colleen, but we'll reiterate. Is there any standard provincial guidance for active screening, or do we take the materials provided by local PHUs available from the province?
There is provincial material as well as local material as well. So the links, there's links for provincial screening for workers and for patrons. And the school screening as well is provincial, but local officials some have developed their own that are consistent with those as well. So either are applicable.
Thank you very much. I'm going to go back to sports here again for a moment. The question is, are coaches and other volunteer staff still exempt from the proof of vaccination requirement? I
believe yes is the answer to that. Nope, Chris is nodding.
No, I think the guidance document was updated so that everyone sort of 12 plus is required.
Okay, thank you very much. Another question related to spectator capacity, and this is for those large settings with a cap of 500 people. The question is for a multi-theater concert venue or cinema, is it limited to 500 people, 50% or whichever is left for the entire building of spectators, so 500, or is it again per room? Sorry, Derek, what setting was that specific to? That would be both a cinema or a large theater and concert hall. So cinema, the 500 capacity, the cap is not on cinemas. It's 50% across the facility. 500 is for spectator events at concert venues and sporting events and theaters. Okay, so maybe just for clarity, let's take a community center with multiple pads. Is it 500 spectators per pad on the call? Okay, yeah. Perfect. Okay, thank you. Thanks. This question goes to Dr. Murty next. Still just looking for clarification on the proof of full vaccination. Is it still 2 doses or is a 3-dose booster required at this time?
Yeah, that's right. At this time for the proof of vaccine, the QR code, it would still be 2 doses. Obviously, we are encouraging everyone to get the 3rd dose. And if you've had it, it'll show up on your system, but it's not required for proof of vaccination. Okay, perfect. Thank you. Okay, I think we've got time here maybe for 1 or 2 more questions. I do have a question here related to QR codes and for international travelers in particular. So the question is, what are the requirements for QR codes for individuals from other countries? Wonder if we could just run through that once again.
Yeah. If you're traveling from outside or abroad, can you hear me?
Mm-hmm.
Yep. Okay. Sorry. So if you're traveling from outside of Canada, the requirement would be to have your proof of vaccination from your home jurisdiction. It could be a paper copy or a digital copy, but it must be readable here in Ontario and must meet the definition of what it means to be fully vaccinated in Ontario or in Canada. Along with that, you will need a piece of identification. We recommend that it be a non-Canadian passport, but in a circumstance such as the US, where we know a number of the jurisdictions are also using the same QR technology that we are, if their QR code is readable, then they're welcome to use any local or domestic identification that they have.
Thank you very much, Jody. I think we've got time for 1 more question here, and it's with regards to the restaurant sector and buffets. Seeking clarification, are buffets permitted in restaurant settings? Yeah, so buffets are a permitted purpose for which patrons can not be seated in their in a restaurant or food or drink establishment. So yes. Perfect. Thank you very much. So I want to thank everyone again for providing us all your questions. I tried to do as many as we possibly could here, but we're over 200 questions and some of them touch on the broad themes there. So thanks for submitting, and we'll try our best to get back to as many as we possibly can. If you do have another question for us, again, you're always invited to email us directly at minister.macleod@ontario.ca. Before we wrap up, I'll throw it back to Minister MacLeod for any closing remarks.
Well, look, thanks Derek, and thank you very much, Colleen, for always being here with us side by side. I'm almost in half jest calling this the 699th day of March 2020. Seems like we've been doing this many times. I'd also like to say thanks to Dr. Murdy and Chris Harold and Jody for being here today to answer some of these technical questions. A lot of excellent questions, and so if we didn't get to them, we will endeavor to get to them, and we're always here to support that. I want to thank my team, obviously Derek and Susan and others, but the person that puts on a lot of this stuff is Ted Scaldwell and Manveer Hundal, Brooke Timpson, Noah Ing. I've got Hassam, Kalo, and of course Susan and Derek and William Snowball, and then the team over in the Deputy Minister's office and the deputies and the Deputy office, so Sarah Harris and Tyler Curry, Catherine, and of course Tony Merzetto's on here. So big thanks to the big team effort to both deal with the restrictions and then when they're eased to make sure that we're getting the voice of the small businesses, large businesses, and the volunteer and not-for-profit sectors into public health officials' hands. So want to say thanks to everybody. And then obviously to all of our sectoral partners and stakeholders, a big thank you to you for joining us today, asking the questions, helping shape the recovery, both social and economic, in the province of Ontario. I really wish all of you, very well on Monday as you reopen, and I look forward to seeing and hearing about your successes. And I'm going to be starting to hit the road next week as well, just to support our heritage sport, tourism, and culture industries as we begin this road to recovery. I've said it many times, we were hit first, hardest, and we are taking the longest to recover, as has been evidenced. And next week we'll be unveiling the recipients of the Tourism Recovery Program. And of course, the Reconnect Festival Event Program and sport hosting have been open, and we're accepting applications. So looking forward to have more to say as we move forward to a provincial budget on those matters, and supporting you any which way we can to the best of our abilities. So thanks, everyone. I hope you have a safe and good weekend. I hope it's not too cold where you're at, and I look forward to more good news in the days and weeks ahead. As Ontario slowly, gradually, and safely reopens, and the support to our very critical sectors are there. So thank you, and keep contributing to that spectacular double bottom line, and each one of you are doing very important work to make people want to live where they do and visit our province. So thanks, and stay safe.
Thank you, everyone.